One thing that's inspired us from the beginning of the conversations with CommonSpirit and Christine is they said, listen, we're not going to solve this in an easy place. We're going to go to a place where the need is the greatest, and we're going to solve it for the communities that matter most about us. And I remember when they said, we really want to bring this to the Inland Empire, I said, well, it's not Medicaid, and California is not paying for it yet. So that's going to be complicated. There's a lot of managed care out there. So on the commercial and Medicare side, it's a little bit more complex. And they just put their foot down and said, this is the right thing for the market. And we're going to use our resources, our brand, our people to bring everyone to the table. And as you imagine, it's a little bit easier to go hand in with, along with Christine, we're going to go talk to the plans and other stuff and say, listen, this is the right thing to do. Let's figure it out. And a little bit, if we can figure it out clinically and if we can figure it out financially there's nowhere in California we won't be able to do this, and there's nowhere in other CommonSpirit markets. That's been inspiring, and it's been exciting to do that, because we know to be useful at the point of care for that primary care provider, it needs to work for everybody. Those physicians, they're doing so much. They're seeing 35 people a day. They know 3, 4, 5 of them every day are going to have depression, anxiety. If we can find a way to support all of them, it's a life changer for them clinically and operationally. Oh, I have this person, they're my partner. Anytime I identify these problems, I know someone's going to be reaching out to the patient, checking in, documenting so that I can see the record, giving me useful recommendations. If you take a plan-centric view and you say, well, for my Cigna patients, I got this, for my Aetna, ACO patients, I can do that. That doesn't work, right? It doesn't work in the day of the life of the doctor. And I think that's something we've been passionate about. We're so excited for Christine's leadership and on the ground to say, we're going to make this work at point of care, which means we have to make it work cross-panel for them, all payer. And that's what unlocks the behavior change that drives the clinical outcomes that we all want to see.